Many communities in Oklahoma, and rural Oklahoma in particular, do not have physicians there. And rural Oklahoma is very important not only to Oklahoma, to our economy, but to the United States from an agricultural standpoint. And so having physicians in those communities so people can live there, be healthy, farm, participate in agriculture is very important. In the FFA program, our Blue Coat to White Coat program is really about identifying students who already embrace the rural lifestyle. They live in those communities, they understand leadership, they understand hard work, and they understand commitment to community.
And when you think about the motto of FFA, it's learning to do, doing to learn, earning to live, living to serve. That's the motto of an FFA student, a student leader in FFA, but it's also a very fitting model for a student who might pursue a career in family medicine.
So anything that we can do to increase, enhance, recruit, retain primary care physicians in all parts of Oklahoma, primarily rural Oklahoma, is a huge benefit.
The Blue Coat to White Coat program is unique to Oklahoma State University College of Osteopathic Medicine. No other medical school in the nation is targeting agriculture education students.
All the time I can think back and relate things, even now in classes I'm taking in medical school, back to things that I did or have done through the FFA and the agricultural world.
Through FFA, it has taught me responsibilities. It has taught me, I have livestock that rely on me. I need to be there for them. If something is wrong with my animal, I need to be able to see it and know how to treat it.
Oklahoma FFA is developing tomorrow's doctors. Through the agricultural education component, they are learning biological sciences. What they're learning in the core classes are then strengthened through the agricultural education classes, as well as the leadership components that they're going to gain from the FFA. The Blue Coat to White Coat program is a win-win for Oklahoma. We work closely with Oklahoma FFA on multiple levels. Local FFA advisors at the State FFA Convention and participating in career development events. Through these efforts, we find and engage high-achieving rural students. We invite them to Operation Orange, our traveling medical school camp. Then they have the opportunity to participate in Dr. Pete's immersion camp.
I made a good choice to come in here. I made up my mind that I'm going to go into the medical field.
That was just so cool to actually see physicians doing what they do, like see how the patients reacted to it and what impact they really have on the communities.
The program culminates in a one-to-one mentoring program with current medical students. It's going to dramatically change the profile of our incoming medical students.
That's why I'm so pleased with OSU's mission of populating rural Oklahoma with physicians that come from rural Oklahoma.
You need somebody that grew up in rural Oklahoma, understands rural Oklahoma, wants to serve in rural Oklahoma. That's the student that will go through the process, become a doctor, and go back home.
I think it dovetails just perfectly. So if there is one secret sauce to this recipe of why it's successful, I think Dr. Schrum and her team and Oklahoma State University picked the right group in the FFA students to target, and I think that's why this program is going to be very successful and will truly change the future of our state.